and all the way from the UK. We'd like to welcome you here in Sweden. Is it your first time here?
It is. I'm blown away, to be honest. It's a beautiful city. Yeah, I'm blown away. It's absolutely gorgeous here.
Really? Okay, that's great to hear. Is it your first time also to hear about Digital Health Days?
Yeah, it is. I recently got into the digital health market back in Liverpool in the UK. It's an emerging market. In fact, there's a little area of Liverpool which is now developing as the kind of digital centre, and digital health is definitely on everyone's lips over there. So it's great to come to a big event like this and see how it's having an impact internationally as well. It's very fascinating.
Are there any similar events in the UK?
Yeah, actually, I'm involved with the eHealth cluster in Liverpool, and we try to do very similar regular events to support the people around the northwest to get more involved, have more co-creation and more involvement amongst businesses, academia and science networks to try and better the digital health market. So there's actually a lot going on in the northwest at the moment.
So can you tell us a bit about your company, or let's say companies, and what you're doing exactly in the field of eHealth?
Yeah, well, the cluster, there's a number of companies involved. There's a lot of work going on around dementia at the moment, and that comes down to the fact we have great networks such as Innovate Dementia in the UK, who are providing amazing amounts of support for not just big businesses but small startup companies, entrepreneurs, and really pushing them and giving them real routes to market around dementia apps. So those types of foundations really help the digital health scene, and we're seeing now that the cluster's growing. We're getting more and more involvement from different sectors, so it's a very exciting time, yeah.
Just a side question, since you also have a perspective of the UK eHealth. Here in Sweden there are many politicians who are involved in decisions. How about the UK? Is it similar or is it different?
Yeah, we get a lot of support, especially from local government. One of the strange things about the UK at the moment is that it's quite centralised in London, so being up in the northwest, there is a risk that we'll miss out on some of it, but the local authorities within the northwest are so supportive. They really understand the power and the impact that digital health can have, and that they're pushing it to the front. So yeah, loads of support up there.
But when you say digital health here, the term itself is very broad. Can you give examples of projects that are already going on right now?
Yeah, absolutely. One of my most exciting projects, I think, was a company, Red Ninja, who've developed a fall detector. I was just in a session then, and they were talking about the ethical choices of having video cameras in the bedroom, and even though that could save such a significant amount of cost and provide a better service, there is still a lot of privacy issues. But Red Ninja have developed a piece of technology the size of a fire alarm that actually uses not cameras but different types of chromatic sensors to detect where people are, if they may fall over. If they do fall over, it can automatically send a message to ambulance services. So these types of innovations, I think, are really significant, and I'm expecting those types of products to have a huge impact. And then on the more kind of software side of things, we have companies like Citrus Suite. They're the ones who've been working with Innovate Dementia. They've developed a brilliant picture frame that'll provide all kinds of reminders and alerts for those suffering from dementia. So it's not about replacing the care services that we currently have, which are actually really effective in England at the moment, but it's about supplementing them with new ideas. So yeah.
What kind of support do you get from the UK government or from investors back there?
Lots of support, especially from the science networks. You know, it's a big interest. Within the government itself, we've seen some pretty drastic cuts to healthcare and social care recently. But with that, the government themselves have been very supportive in helping us along through that process and making sure that, you know, we're not dropping the ball, essentially. Even though we have to look at new ways to cut costs and do things more effectively, they're being very cautious and making sure that people's health is not going to get damaged and there's no safeguarding issues in that process.
I bet you spoke with your Swedish counterparts, startups. If you compare the support that they get here to the ones that you get there, how do you find yourself?
I was actually quite surprised when coming over to Sweden. I was expecting a real disparity between the NHS system that we have in England and the insurance system that takes place in Sweden. And I was shocked that when I arrived, there was more similarities than differences.
Wow.
I would say the major differences between the two countries is possibly just the kind of British pessimism. We're not quite as excited, and every time I speak to someone from Sweden or Stockholm, that they're so excited about what's taking place. They're very positive about what's happening. That doesn't always happen in the UK, but at the same time, the tracks that we're going down are actually very, very similar.
Well, I'd like to thank you for being here, and hope to see you again in Stockholm soon.
I hope so too.
Yeah,
Thank you
thanks
very
a lot.
much.
Thank you.
Cheers.
Thank you.